perhaps 85 paise in the rupee goes into administrative expenses. Kirit Parekh, who was a member of the Planning Commission, looking at another scheme, said that Rajiv Gandhi was completely wrong. It's not 85 paise, he said, but 83 paise in the rupee, which goes into administrative costs. And the Prime Minister has said on record that he is skeptical about this figure, which is why I have given the range of 75 to 85%, getting wasted on the expenditure which bureaucrats undertake to maintain themselves, and now increasingly their comprador non-government organization chums. This has become the new nexus of exploitation, the NGOs and the GOs together, discovering that not until they have alleviated their poverty to the extent of 85 paise in the rupee can they spare 15 paise for those who are genuinely poor. So it's no wonder that outcomes are so derisory. Worse, precisely because over 100 schemes, the current number is approximately 139 schemes. I have to say approximately because there is an amoeba-like merging and separating of government schemes that takes place. So I'm safe if I say over 100 schemes. In fact, it is said in our government that ministries scheme and the planning commission plans, and that's how we get the planning process going in our country. So worse, precisely because over 100 schemes are delivered to the same set of beneficiaries through mutually insulated administrative silos set up by central government ministries intent on jealously guarding and zealously guarding their respective fiefdoms, convergence of schemes at the delivery point becomes virtually impossible. I'd like to give an example of this. We have two separate schemes run by the same minister but under two different departments. Sanitation scheme, monies are provided for beneficiaries who wish to use them to put in-house toilets. Now, because the Indira Habitation Scheme is run by a different department, they provide free housing but without toilets. And then the minister says you go to a different scheme called the Total Sanitation Campaign to get toilets. And since 2006, that is 5.5 years ago, I say this on the basis of an answer to a question which I put to the minister only in the last half of the budget session. He said that we have attempted to converge these two schemes. So my innocent question is, why don't you merge them instead of converging them? Why not provide poor people with a house that has a toilet? Especially as the minister, to the best of my knowledge, has several toilets around his house instead of merely one per person. Now, why do they do this? There is, given the fact that a study done by the DFIYD indicates that 6% of India's GDP goes into health costs, whereas the government's contribution to health is 2% of GDP. So the single most important reason for people who are crossed the poverty line and become vulnerable, falling back below the poverty line, is diseases caused by open-air defecation. And this one simple sociological fact of India, that the unique smell of India is that of male urine on the streets, doesn't seem to have penetrated the air-conditioned rooms in which all those distinguished gentlemen, including Mr. Reddy, live when they're not on the stage here for session 1. So it was to object to their attitudes that I walked out of session 1. And they've repaid the compliment by walking out of my session. Anyway, the point is that when we have so many schemes being delivered to the same beneficiaries through mutually isolated insulated delivery mechanisms, delivery silos, we end up with convergence of schemes at the delivery point becoming virtually impossible. Beneficiaries are thus deprived of the multiplier effect that would operate if the beneficiaries themselves, through their locally elected leaders, were to have the authority to plan and implement the utilization of these resources in keeping with their own respective priorities. Now, the approach to the 12th five-year plan, which is a critical document, it's the document that is prepared by the Planning Commission after consulting the people of India. And the Planning Commission's idea of the people of India are those who have access to websites. I mean, they don't realize that a huge proportion of our population is illiterate, and most of the rest are neo-literate or have been literate at some stage in their lives. But by putting it onto a website and getting a certain number of what I'm told are technically called hits, they arrive at the conclusion of what the people of India desire. So they have, the people of India then send in their comments saying, you know, rubbish or nonsense or whatever it is they say. And then on the basis of this, ignoring all the rubbish and the nonsense and taking into account what a wonderful man you are, Montek Singh Ahluwalia, the Planning Commission prepares this document called the approach document. And the approach document is then taken to the National Development Council. The National Development Council comprises the Prime Minister of India and all the Chief Ministers of India. Now, the approach to the 12th five-year plan states on page one, that the annual average rate of growth of the economy in the last 5 years has been over 8% per annum. And then at the bottom right-hand corner of the same page one says that the annual average rate of growth, the rate of poverty alleviation over the last 11 years, you'll notice the first was 5, so that the entire credit can go to my government. The second is given as 11, so that some of the blame can attach to our predecessors. It says that the annual average rate of poverty alleviation over the last 11 years has been 0.8%. And I heard Dr. Montek Singh Ahluwalia here saying that the great achievement of India, he said, is that the poor are not becoming poorer. He's absolutely right. The poor are becoming richer at the rate of 1.4% on average. Whereas the rich are becoming richer not at 8% per annum, but because they are benefiting most from all the growth process at about 8,000% per annum. So we got this growing inequality. And the first figure that I heard, which shook me even more than the fact that the economy grows at 8% per annum and the people grow at 0.8% per annum, was Bibek Deb Roy telling us that after examining as a first step, as an initial exercise, the NSS, that's the National Sample Survey, results of consumption in the Indian economy for the last 5 years, he thinks that whereas the urban Gini coefficient of income, which measures inequality in income, in the previous 5 years was 0.362%. That's the figure given in our Economic Survey 2011. In urban India, it's gone up to 0.65% in the last 5 years. There's been a doubling of inequality in our country. And therefore, I'm very glad that Frances Stewart is with us. And that she's telling us, trying to tell us, in most sober terms, what the Maoists are trying to tell us in our forests with guns. That if you're going to have this kind of inequality accompanying higher growth, you're destabilizing your development process and you are disrupting your democratic process. Anyway, this approach to the 12th five-year plan, which is from this year for the next 5 years, it concedes that the biggest failure of the 11th plan, which was 2007 to 12, has been the failure to secure inclusive growth, but attributes the failure principally to management failures in the states in implementation. However, it's my submission that it is not management failure, but systemic failure that is at the root of the general failure of grassroots governance on the part of both the central and the state governments. We are yet to fashion an efficient and effective delivery system for public goods and services to those most desperately in need of inclusive growth. And this notwithstanding the constitutional obligation under parts 9 and 9A of the Constitution to move from bureaucratic delivery of economic development and social welfare, but towards self-delivery through Panchayat Raj institutions of programs of economic development and social welfare, as indicated in the 29 subjects listed in the 11th schedule, which are entrusted by law to institutions of self-government at the PRI level. Therefore, in arguing that the key to systemic transformation lies in modifying guidelines through which the bulk of some 200,000 crore rupees of social sector and anti-poverty spending is effected, allow me to invoke what the Prime Minister, Dr. Manmohan Singh, had to say 7 years ago in 2004, soon after assuming office the first time. He said, and I quote, "It is for us to honestly ask the question of whether we are making the best use of the money that we spend annually on the schemes being currently implemented. Do we have too many schemes which are fragmented in concept, are rigidly designed, and impose national parameters on highly differentiated local realities in terms of resource endowments or felt needs? Does the compartmentalization of our effort in multiple schemes in the ministry or ministries, both at the center and in the states, without a core vision, make this investment suboptimal? Before we set this right at the center, we cannot," said the Prime Minister, "be asking the states to do so."